Let's start by looking at the experiences. Max you can put are 10 experiences. So really feel, trying to bring this down to 10 experiences helps program directors because they can really focus on the most important experience. Besides the work, research, and volunteer experiences that were present previously, you can choose to have your experience as education training, which basically means for IMGs, their postgraduate training, their residency training in their home country, other extracurricular activity, and so the hobbies section has now moved. Professional organizations, nothing much. Maybe if you had some kind of a leadership role, you can talk about that. And there are teaching and mentoring experience. So let's start looking at that. These other things like what is the participation frequency, the setting, these are optional. You can see there's no asterisk here. And you can choose, how frequently that participation was in that experience, what kind of setting that it was. And these are the primary focus areas, whether it's research, basic science, clinical science, community outreach, I'm not sure about customer service, healthcare, improving access, and so forth, and so many of them. And these are the key characteristics that can be said about each experience. Now, it's going to be very difficult to decide which key characteristic to choose, but do your very best. And I'm going to again share examples here with you. I feel programs might try to filter experiences based on this. So that's one way of looking from the program perspective. And I think they're trying to get more information in an easy to read format. So let's look at the first example, clinical work experience. Of course, on the top, you're going to write the name of the organization, experience, of course. Now, the position title, this is where you have to be as specific as you can. Intern, observer, extern, medical student, postgraduate work, whatever is the right title for you, choose that. And I highly suggest you include specialty in here. So, for example, extern in cardiology, extern in hematology, oncology, that kind of a thing. Because you really want to give as much information from the titles as possible. Start date and it's all very clear. Now it's daily because, from this February 1 to February 28, every day you are doing this clinical experience. Of course, weekends may or may not count, doesn't matter, but at least it was a daily, work that you were doing. Urban, clinical translational science seems to be the best option for this clinical work. And the reason why I chose empathy and compassion, we'll see next. So this is an example of a narrative in that paragraph, and this is what I propose you put when you're describing a clinical experience. What setting it was, inpatient and outpatient setting, under supervision of the name of the attending. This is the only place you can put their name. What did you do in this rotation? Perform history and physical exams, devise treatment plan, presented 4 to 6 patients daily to the resident team, documented progress notes in EPIC EMR. So 2 things you'll note. I'd like to describe that you interacted with residents, fellows, and attending. It gives a sense to the program director that there was some teaching, some education involved here. The EMR is super important nowadays. You really want to show familiarity with the EMR, whether it's EPIC, eClinical Works, Cerner. Definitely include that in your narrative. Third point, devise differential diagnosis and strategies for evaluating hematological abnormalities, all this anemia, thrombocytopenia, assisted in bone marrow biopsies under the supervision, presented. Now, what was something unique this applicant did? Presented a review of tumor lysis syndrome in a noon conference. And then they gave a little bit more description, learned about stem cell transplant indications, complications, and so forth. So this is a very nice, very comprehensive narrative description of what this experience involved. And you remember the character count, 1020 character count. I looked at it, I think this was about 700 characters. And you can see it's all presented in a bulleted form. So again, I discourage applicants from writing this as a paragraph, write it in points, just like what I've shared with you today. So if, again, you want to look at what's a good format, that I recommend for writing the clinical work experience, 4 to 6 points. Again, try to keep it as concise as possible. You want to respect the time of the program director. This is write the setting, outpatient, inpatient, name of the attending, that you interacted with just the attending or the resident team. What were the activities you performed? H&P, progress notes and EMR, rounds. Maybe you did night calls, so talk about it. What was your work? Medications, labs, radiological studies. Patients you saw is a bit optional. I'll leave that to you. Or if you were doing an observership where it's, you're not really directly interacting with patients, you can say directly observed, participated in daily rounds, and discussed management of hospitalized patients. Talk about something unique that you did. I presented a review of this. I presented a review of that. And education, I participated in the morning report or noon conference. I think this is a very nice, comprehensive, narrative that you can put when you're trying to describe the context, roles, and responsibilities. Here's another one that I'm going to share, clinical work experience. So again, just like the last time, write the position title, include the specialty in the position title. And let's see here. This is more of critical thinking. This is another example. This is in cardiology. Performed history taking an exam of patients with diverse cardiac conditions in outpatient clinic with Dr. So-and-so. This seems more like a clinic rather than a university hospital. So it just says cardiology attending. Presented patient assessment and plan to the attendings, age and comorbidity screening, reconciliation, vaccination reviews, kind of whatever they did. Learned the indications and interpretation of this, echocardiogram stress tests, correlated these findings with the clinical presentation, recorded SOAP notes and e-clinical work. So this is exactly what I was saying. You have to include the EMR that you're familiar with. Conducted daily consultation visits. They did something unique. They presented a review of the Takotsubo cardiomyopathy to attendings, nurse practitioners, and externs. That's kind of how a clinic is set up. And they assisted in EKG's stress test. So this is a very nice narrative. And I really don't think you should write more than what I've described in these two examples of clinical work experiences. Okay, now this is about an internship. The clinical work experience, a lot of IMGs do internship in their home country. So you're gonna write your name of your med school there as an organization, position title, intern, clinical intern, if you wanna write, that's fine. 1 year time period, sorry, the start date is wrong, but 1 year time period. And daily recurring critical thinking and problem solving. That's kind of what typically done in internship. So this is how a narrative for that 1 year internship would look like. As part of the internship, I rotated in internal medicine, pediatrics, general surgery, anesthesia. This is the name of all the specialties. Participated in all aspects of patient care, daily rounds, diagnostic planning, this and that. Monitored patients, wrote notes, admission orders, discharge summaries, morning rounds, handoff, and did these procedures. And again, this I feel is very comprehensive. Really nothing more than this needs to go in your ERAS CV. So we saw 2 clinical experiences, US clinical experiences, 1 internship from med school. Let's look at the 4th experience, which is going to be a research experience. So again, name of the hospital, research assistant. Will be nice if you can include specialty here. And again, daily recurring. This was something about quality improvement. So let's look at this. Now, this is shorter than the description of the clinical work experience. Assisted in research activities, GI and hepatology with attending, name of the attending. Just in case a program director might recognize that the name of that attending, it's always nice to include their name. Performed literature search, analyzed the papers for the manuscripts, abstracted data on research from the EMR EPIC. I mean, that's kind of how their study methods were. Collaborated with biostatistician for these projects, and natural history of NAFLD, role of fibroscan, and the outcome presented 2 posters at this conference, Digestive Disease Week and ACP Michigan. So the format for research work experience is as follows: 3 to 4 points. This is, remember I told you this is shorter than the clinical work experience. 1-line summary of the study design and the objective. What was your research role? That's the most important. Data collection, formal analysis, investigation, writing, review, editing, and so forth. If you're the first author of that research work, it deserves special mention. So definitely include that. Funding, if you did get that, and status of the research, whether it's presented, published, where exactly is that research work in the journey to getting published. You absolutely have to describe that. You don't have to talk about what were the findings of the research. There was one application I reviewed, they were talking about the p-values and everything, and that's absolutely not needed in a research work experience. Leave that for the interviews where they might ask you, what did you find in that research, and then share it at the interview, not here. The focus is on the research role, so try to make sure you describe it as best as possible, like in that example, and these are the terms that you can use in that description. All right, then this is another example of another research assistant position, and daily recurring public health, ingenuity and innovation. And this is because they took a little bit more active role in this research. Participated in research projects studying the association between patient knowledge of A1C and the diabetes control, that is their actual A1C level with Dr. So-and-so. And contribution, this was the questionnaire creation, literature search, interviewing, data collection, writing, abstract and poster creation. So you can see the lead author in the abstract. Remember I told you, if you're the first author, take full credit for that and include that. Abstract has been accepted for oral presentation at so-and-so clinical meeting. So this is a nice, concise description of the research work experience that you can put in the ERAS CV. And kind of, again, the 4 points is very nicely written. What about volunteer experiences? Let's look at some. So this is an organization. You're going to have to, give the name. I cannot give the real name of the organization, so I just made this one up. And volunteer medical student. And the focus area was community involvement, communication. So KLM is a volunteer-run humanitarian assistance, disaster response joint operation in the US and Haiti. I participated in a 7-day mission and served as a medical interpreter between French-speaking patients, American English-speaking physicians, helped with triage, emergency medicine, cardiology. Again, you'll notice this is even shorter than the clinical and the research work experiences. Volunteer experiences, just 2 to 3 points, no more than that. That's all you really have to do. Try to keep it as concise as possible. Here's another example. Volunteer experience, Rotary Club India, position organizer of the health camp. So this is a very good title. You're kind of showing a leadership role in this way, and the date and everything, teamwork. So yeah, if you can use words like organized, led, those are strong words. So try to use that in the narrative. Organized a Rotary Club diabetes screening health camp in a village 20 miles from my med school. I led a team of med resident students and nurses and arranged transport and supplies. This team screened the local participants for diabetes, hypertension, and provided health advice on lifestyle changes, healthy diet, and primary care follow-up. Nicely written, short, concise, 2 to 3 points. That's all you need to do for volunteer experience. Now, another entry is a teaching or mentoring. If you had a teaching role, this is also a very nice experience to include, something like this applicant did. Medical school name, teaching mentoring, class vice president. So, and all this is there. So this is what this applicant did, served as student representative in faculty meetings to discuss educational improvements, introduced case-based learning and pathology, team activities, problem-based solving. Based on my efforts, our school's average score increased to second best. So this is very nice. They're trying to give an outcome that they were able to achieve through these efforts. I created a shared Google Drive containing recorded lectures and study notes in Q&A format for discussion. So again, nice and short, 2 to 4 points. It's good enough for teaching and mentoring. All right, hobbies. This is a big one. So let's look at this. Music. I've been playing guitar since high school and can play acoustic and electric guitar in rock and Indian pop music. I also play in local venues with a band and taught guitar to middle school students. Dance, I learned Indian dance, Bollywood Bhangra style in dance academy, participated in group and solo events. Hiking, I'm proud of my 6-mile hike on Snake Mountain in Massachusetts. Yoga, I practice hot yoga every week in a group. I'm a yoga teacher and conduct beginner classes for children. 3 hobbies, I believe, is very good, is enough to include in your ERAS CV. No more than that. Only describe hobbies that you're very passionate about, that you can really describe in detail if someone asks you, and do provide the details like what we saw in these examples. Music. Okay, I play guitar, I play acoustic guitar, I play electric guitar. This is the kind of music I play and I do teach other students. It's a very good description. Don't write things like, I like music, and that's you have to give more details, because you really want to show that this is something that's of interest to you. Program directors are very interested in hobbies because it gives a lot of human touch to you. It kind of, when we look at hobbies, it tells us about you as a person. What are your interests? It also tells us how you're going to handle yourself, especially during residency, when there's so much stress and burnout that's described. So we need to make sure that you have hobbies that you can take care of yourself and have emotional well-being, and provide the details. So I don't want to read CV that says love to spend time with family and friends. No, that's not a hobby. Or I like to read books, I like to watch Netflix. No, those are not hobbies. You have to show creative hobbies that you're active in, and describe in your ERAS CV. So those were the 10 experiences that you can include. Of course, you don't need to use all of them. You can choose 9, but I would highly suggest, do your best, show that you're well-rounded, show as many kinds of experiences in your ERAS CV. Now, the next section is called Meaningful Experience. What's a meaningful experience? And ERAS allows you to choose 3 of those 10 experiences to be included under meaningful experience. So when you write your paragraphs here, you're going to have to specify that this experience identifies with this experience. I'll show you examples. Now, meaningful experience means that you have to describe why it was meaningful to you. Why was it valuable to you? How did it help you? You don't have to write about what skills you learned. They've described it very well in the instructions, so don't focus on that. I'm going to show you some examples. Again, remember 300 characters. So if people on Twitter, they know it's like 280 characters. So it's like writing a tweet, really. Okay, meaningful experience. So this is for that first experience about HEMONG, clinical experience. Observing Dr. Anderson's honest conversations with patients with terminal cancer about prognosis and goals of care taught me empathy and compassion. End-of-life meetings in the rotation helped me appreciate that the physician's efforts should be directed not just towards the quantity, but also quality of life. You can see only 2 sentences. This is kind of like maybe 280 characters or so. And that's why this experience was meaningful to this applicant. If you recall, I wrote that the kind of characteristic was empathy and compassion, and it's because of this. Another meaningful experience. My first US clinical rotation was a steep learning curve for me, both personally and professionally. In a week, I learned from students and residents to communicate effectively with patients and physicians, present on rounds, and document in EMR. This experience made me proud of my adaptability. So again, we're talking about why that rotation was meaningful to this applicant. If you want some hints, what you could do is just go here. Let me show you where, on how to write this, and look at these key characteristics. These are the characteristics that will be highlighted in that meaningful experience. So for example, I talked about empathy and compassion, and then the other one was this resilience and adaptability. That's what I'm trying to describe in this meaningful experience paragraph. Let's look at another example.
Lead USMLE tutor in 3rd year of med school, mentoring medical students, step 1 Spanish English, modeled discipline and perseverance, made a profound impact.
So they're trying to describe why that was meaningful because of the leadership skills that they built, that they're describing here in this meaningful experience. So these are some examples of, 3 meaningful experiences that you can describe about those experiences. The reason why it's important is because this paragraph, the first one about Dr. Anderson, that was linked to that first experience. Remember the one about the hem-onc rotation? What happens is if you link it that way, that work experience is the first thing that the program director will see. So having a meaningful experience, it prioritizes that experience that the program director is going to see. So that's why you have to be a bit careful about deciding which of those 10 experiences should be listed under meaningful experience and have narratives like this, because those are the ones that will be much more clearly visible to the program director. And that's, again, it says that in the ERAS CV guide. Okay, now the next one is impactful experience. Yeah, so the impactful experience, that's another paragraph. Again, this is optional. The meaningful experiences are optional. The impactful experiences are optional. But I do feel we should take advantage of this space to kind of talk about, our experiences. This one's all about challenges and hardships. So difficulties that you had throughout your life until the point when you apply for ERAS. And I'm going to share some examples here. So the keyword is hardship, okay? Let's look at impactful experience number 1. Let me move this to the side. In my 3rd year of med school, my mother was diagnosed with breast cancer. As the only member of my family in medicine, I took it upon myself to face this challenge head on. I accompanied her to meetings with the surgeon and oncologist. Many options were presented that terrified her. I advocated for her to undergo mastectomy based on my literature search and curbsiding other mentors, trying to show an active role here. I assured her that I will always be by her side in this fight. I also balanced my medical school studies and keep up with my classes and tests. Her successful recovery inspired me that being resilient in challenging times and getting support from peers and family are powerful enough to overcome any adversity. So again, it says 1,020 characters. So you have to kind of, you have to write this as an essay, really. And so this really talks about the difficulty and how this applicant handled that difficulty, really showing resilience and had a very good outcome as a result of this, at the end of this challenge. Let's look at another example. Again, the key word is hardships, remember that. Impactful experience number 2. As the first generation physician in my family, I encountered my own set of challenges and opportunities. Growing up in a rural village of Nepal limited the educational opportunities. My parents, who were agricultural workers, appreciated the value of high quality education, supported my studies in residential school far from home. I worked hard to achieve the scholarship from Government of Nepal that covered my tuition fees in med school. I experienced tremendous personal growth in med school and pushed myself to get out of my comfort zone. In addition, the scholarship mandated 2 years of rural service that allowed me to give back to my community, and that continues to support my journey to US residency. So again, talking about the hardship that this applicant faced before starting this journey to US residency. All right, let's talk about the next part, which is about geographic preferences. This is something, again, that's new in the ERAS for 2024. Now you can choose which geographic region you prefer to do your residency in, Pacific, Mountain, and so many out there. Now you can choose up to 3 geographic regions. And whenever you do that, you have to give a description, and I'll kind of share some examples there with you. You can choose to say, I do not have a division preference. Again, you'll have to write some narrative about that. Or you can skip this section completely, and then no information will be provided to any program. So you have a couple of options. Let's look at some. So I want to explain to you what the choices mean to the programs. So say the applicant is applying to a program in Philadelphia and Chicago, and they give these preferences: Middle Atlantic geographic preference, East North Central, which includes Illinois. Okay, so if this is the geographic preference and these are the programs they apply to, the programs will get this message: the applicant prefers Middle Atlantic. So just the region that the Philadelphia program is in. And the Chicago program will get the message: applicant prefers East North Central, that is Illinois. They're not going to know about the other regions that the applicant may or may not have chosen. Say the applicant did apply to these two programs, but preferred the Middle Atlantic and the West South Central, that is Texas. So here in this situation, the program, the Philadelphia program, will get the message: applicant prefers Middle Atlantic. Chicago is not going to get any information. Okay, so the Chicago program will not know whether this is their geographic preference or not. It'll be blank. If this applicant just chooses, I don't have any preference, the Philadelphia program and the Chicago program will get the message that the applicant doesn't have a preference. If you leave it blank, no information is shared with the programs. So this is important to know what is the impact of the choices that you make under geographic preferences. Typically, you will choose these geographic preferences based on family, friends, familiarity, and I can share examples here with you. The reason why it's important to know about this, in the last 2 years when the ERAS was doing all this research, they are saying that your chance of getting an interview invite is greater if the geographic preference that you give matches where the program physically is. So if you say, I want to be in the Philadelphia, what's the name of that? The Middle Atlantic. If you want to say that, if you say want to go to the Middle Atlantic region and apply to a Philadelphia program, your chance of getting an interview invite goes up. And that's what exactly they say here as a conclusion. Applicants whose geographic preference aligned with the program location were more likely to be invited to interview than applicants whose geographic preferences did not align. So keep that in mind when you are deciding upon your geographic preferences. And here's the narrative that you can write for the geographic preferences. Now, this is someone applying to the New York region. My best friend from med school works in Long Island, New York. I prefer to be in the Northeast region to be available to visit her often for social support during residency. And this is very desirable. The reason why geographic preferences are being given so much weight nowadays is because they want to make sure you have social support, friends, family, because this is like the biggest negative predictor, the biggest deterrent to burnout. And so that's why programs want to make sure you have someone in the region, someone that you know. And this is a very desirable. Another reason you can give for a geographic preference: I completed an observership in Worcester, Massachusetts. I prefer to be in the Northeast region as I'm familiar with the New England culture. I also love the 4 seasons, opportunities, outdoor activities, hiking and skiing. You can give that example. And this is a little bit another example that you can give. Growing up, I often visited my grandparents in Atlanta, Georgia. I love the Southern hospitality, multicultural diversity, and warm climate the South Atlantic region has to offer to me and my wife. So it's okay. It's you can certainly talk about this also if that's you have a preference for that region. If you don't have any preference, you still have to write a narrative. You can write something as simple as this: I do not have any preference. I'm willing to relocate for the right opportunity. Again, I highly suggest you identify geographic preferences and give reasons like what I've shared here with you. You choose, I do not have geographic preference, kind of not the end of the world, but at least from the data that we have seen, if you have a geographic preference, the worst things that's going to happen is a program that's outside the preference, the region, is not going to get any information at all. They're not going to find out anything bad about your choices, about your preferences. And giving the geographic preferences and applying to programs in that region, at least from the data that we're seeing, you do have an increased chance of getting an invite. Now, what's happening is, in looking at data, it's clear there's a lesser proportion of international medical graduates providing geographic preferences when you compare that with US medical graduates. And this is data shared with AAMC, where it shows a percentage of no geographic preference. So choosing I do not have geographic preference by the student type for top 10 specialties. You can see here the orange bar is IMGs. So you can see about 25, 26% shows I do not have geographic preference as compared to the others. Now, why is that happening? So one reason could be, yes, clearly, these are international medical graduates, don't have any roots, don't have, contacts, families, so they can go anywhere. And that's why they're choosing that option. But working with some residency applicants, what I've been hearing is IMGs are afraid that they might offend a program that's outside the geographic preference. What does that mean? That means that, say, someone chooses Northeast as their preferred geographic region, they give that geographic preference. So if you apply to a program, say, in Texas, some of these residency applicants feel they may offend the Texas program because that's outside the geographic preference. So that's what generates confusion, and that's what I've been hearing. What do you do when there's so much confusing opinions? We look at data. So that's what I'm going to present next. Just like in medicine, that's what we do. So let's look at internal medicine. And again, ERAS and AAMC have provided this information from just this last residency application season, 2025. So the data they're providing here is on the y-axis is a geographic preference to interview conversion rate. So what is the likelihood that providing a geographic preference led to an interview invite? So you can see, let's start with this, no geographic preference. So if someone chose, I do not have geographic preference, their chance of getting an interview invite is somewhere like, 3 to 4%. Of course, they look at the rest of the application, but we're just focusing on this section of the ERAS application. Now, if the geographic preference is aligned, that is, if you say, I want to, my geographic preference is New England, and you apply to a Massachusetts program, then the geographic preferences are aligned, and the chance of getting an interview is higher. You can see it's about 11, 12%. Now, what's very interesting is the next part, which is if the geographic preferences are not aligned. So it's that situation where, the applicant provided New England as the geographic preferred region, but it's applying to Texas. You can see that in that case, the chance of getting an interview is the same. It's about like 2 to 3% and 3 to 4%. It's about the same as not providing a geographic preference. So what does this mean as a residency applicant? What it means that, when we're looking from your side, your perspective on how to boost your interview chances, programs outside your geographic preference, that is this part, the green bar, treat you the same as if you gave no preference, like the blue bar. So you lose nothing by choosing one or more geographic regions of preference. So providing geographic preferences and providing the reasons only helps you stand out and does not harm you in any way. So that's why my recommendation to every residency applicant is provide 3 geographic regions of interest to you, provide reasons, and that's really the best you can do to boost your interview chances. I have seen residency applications, including some who did not match. There were some who did not provide the geographic preferences. Some provided but didn't write reasons. So those approaches are weakening their application and interview chances. So please, please, please provide the 3 geographic preferences. If anyone tells you otherwise, show them this bar graph. It's on AAMC, and then challenge them about why they're making a different recommendation. And these are some IMG-friendly geographic preferred regions. I've looked at this data from, again, AAMC. So these are the states where, that are taking the most number of IMGs. And then I kind of broke it down to the preferred geographic regions. 1, 2, and then 3 can be anything else, really. So do look at this. And if you really can move anywhere in the US, I would suggest taking this approach and choosing 1, 2, and 3 and providing those preferences to the program. There are two specialties in this upcoming match that will not look at geographic preferences, which is orthopedic surgery and otolaryngology. They're doing some kind of a pilot. There's another thing called setting preference. Not much has been written about this, but it's basically, suburban, urban, rural setting that you prefer. Now, I've given like these three regions: Pittsburgh, urban; Burlington, Vermont, suburban; and Greenville, Ohio, rural. Okay. If the applicant chooses suburban and urban, all the programs will get to know that this is your preference, suburban, urban, and so forth. There is a preference for suburban/urban, so you can certainly choose that. You don't have to be specific, just suburban and urban. Okay, so I just want to let you know. I don't have any preference, so all the programs are going to know that you don't have a preference, or you can be blank. Yeah, so don't apply to a rural program if you're choosing the suburban/urban, because this is a message that they'll get, and of course they're not going to invite you if they find out that's not your setting preference. Signaling. How does signaling help? Again, this is data from ERAS, and it says that applicants who signaled a program were more likely to be invited to interview than applicants who don't signal a program. Now, this is not universal. If there's like a very popular program and they're getting too many signals, then it kind of becomes very difficult to understand who's really interested or not. But in general, if you look at all the data, it does say that the signal is for a way of showing your interest. The different tiers of signaling, there's this gold and silver signaling. So especially for internal medicine, a lot of you may be applying to internal medicine. There are 3 gold, 12 silver signals. Now, ERAS had a webinar on this trying to explain why these changes were made, and that the changes were made based on feedback from the residency applicants saying, we don't have enough signals, and feedback from the program directors, because there were like a small number of programs that were getting a lot of signals. So if a program, say, is getting 2,000 applications and say 500 signals, it's very, very difficult to understand what to do with the signal. Should that program recognize a signal? Should it not look at the signal? It becomes very confusing. That's why ERAS, decided to increase the number of signals. I'm taking internal medicine as an example, and have 3 gold, 12 silver signals. And it's being described that gold basically means most preferred program, and silver is, yes, I'm interested and it's preferred. But they're trying to divide it that way. So there is certainly more interest in specialties who want these signals from residency applicants. There are new specialties participating, who want to get the signals, like internal medicine, medical genetics, pediatric medical genetics, pediatric psychiatry, child and adolescent psych, plastic surgery. So new specialties are joining in. PM&R, they have increased the number of signals. Internal medicine has stayed the same, but radiology, diagnostic, interventional radiology, and interventional, they were earlier clumped into one group, but now they have there are 2 different specialties, thus allowing more signals. So there is an interest among programs to get these signaling messages, which is great. Of course, then the question is, how do you decide which programs to signal? And the answer lies here. Again, this was a survey done by AAMC and ERAS, where they surveyed the residency applicants on how they used the signals. And these were some ideas shared by the residency applicants. So some signaled a program where they really wanted to live, maybe that city, town, that kind of a thing. The programs, some residency applicants signaled a program that had something of a career interest to them. Maybe it had a hospitalist track, maybe it had a primary care track, or it had a certain fellowship that they were very interested in, and that's why they signaled a certain program. Some signal the program because it was close to friends and family. So having that social support is essential. So that's what that was done. Some residency applicants signal the program looking at their chance of getting an interview offer based on their USMLE scores, based on other rotations they may have done there, of externships, observerships. Maybe they did a research with someone at that institute. So that kind of increases your perceived chance of getting an invite. And the last is the perceived good fits. So some residency applicants chose a program because they felt they would fit very well with that program. Maybe the IMG friendliness, familiar resident in the program, or having an alumni. To that list, I'm going to add this another thing, that signal a program where you can confidently, clearly, and specifically answer the PD if asked in the interview, why did you signal my program? So you should have a very strong reason, very strong answer to that question, because that's how you're going to show the interest to the program. So it can't be like, I signal your program because I like the dedication to teaching. Every program is dedicated to teaching, so that's not specific enough. But if it's like, okay, I've lived here, or I've been here, my family's here, and give very clear reason, that just helps you be more interested. The program's more interested in you if you're able to provide those reasons. So in addition to all the factors we saw earlier, ask yourself, if I'm asked by the program director, why did you signal my program? Can I give a strong enough answer? And then and based on that, you decide to, signal that. Honors and awards. So this has also has been upgraded. They would give a text box and you would describe all the awards. But there was a lot of confusion, even in the ERAS CVs that I reviewed. I would not know why they got an award, why they got say, a certificate of honor award. You know, the details were missing. They got it because they scored the highest in their exam, or in the 10th percentile among so many students. So that information was missing. So I believe they have tried to more streamline that by now having you choose, okay, what kind of award did you get, and description and date. So let's look at some examples. All this other honor societies and all professional is the same, but there's another section that's been removed called other awards and accomplishments. And I think that's good too, because people were, including stuff from like high school and so forth, which is not really needed in an ERAS application. So this is one example of an honor or award: academic excellence, gold medal for best outgoing student, awarded for highest score in final year in a class of 150 medical student, and the date. This is perfect, and this is the amount of detail that they're looking for. Another example is scholarship. So, many IMG colleagues from Nepal, they get scholarship from the government. So full tuition scholarship, awarded full tuition scholarship by government of Nepal to pursue MBS. So this is very nice, very clear, and a program director will exactly know what this award was about. Okay. Postgraduate training. So this year, there's now a category called other accredited residency. So if someone an IMG has done postgraduate training in their home country, can choose this, and then it will ask you to free text what that accrediting body is. So you can write, these are some options, like there, and like Master of Surgery, National Medical Council India, DNB, MED, different degrees, and what's the accrediting body. There's a character limit, 100 characters, so you might have to abbreviate it, but this is a nice addition to the ERAS application. This is the third time they're revising this section on extensions and interruptions. The good news is that it's much simplified, much clearer, and what they're asking you for are academic extensions. So if you had to repeat a test a year, or you had to, was a remediated coursework because you did not pass something, then you have to describe that here. So if you had to retake exams in med school due to failed attempt or medical reason, then you're going to have to answer yes. But there's no need to describe internship that was extended due to USMLE preparation or US clinical experience. The second part of this extensions and interruptions are professional extensions, gaps or breaks due to professional sanction or any adverse actions by the med school. And this is basically remediation for unprofessional behavior. Hope this never happens with anyone, but if there were breaks in your med school training because of unprofessionalism, such as substance use, harassment, those kind of adverse serious issues, then you're gonna have to choose yes and provide the explanation. And not really providing a lot of personal details, but it says here the reason, the time frame, and what steps did you take to overcome it, and what did you learn from it. All right, let's move on to research citations. So for journals that you have authored, write down your name, enter all author names. They describe how to, present those names, last name, comma, first initial and middle initial. Now, the thing is, if you have many authors, it's going to be a little bit difficult for the program director to find your name among the so many authors. So one strategy is to capitalize your name among the list of the authors. This way, it can be very easily read by the program director. Some residency applicants even put an asterisk next to their name so that I can quickly find, that applicant. I can quickly find that applicant's name in the list of authors. So keep that in mind. Publication name, write the full name of the journal. Don't abbreviate because some may not be familiar with that journal. All this information is very clear. Now, the others category is this one: peer-reviewed journal articles, abstracts other than published. Now, the first thing is you cannot list a paper if you have not submitted that to a journal. So your job is to be as accurate as possible on the date of submission. So on the date of submission, that may be even like a day before ERAS allows programs to download your application. You can certainly describe the most current status. If you've got it to the submission stage, if you're able to submit that paper to a journal even a day before ERAS, you can certainly write that the paper has been submitted. But otherwise, if you're still drafting it, there's no real place for you to describe that paper. Maybe under research experience, but you can't really cite that paper here. Okay, then the other research category is the poster presentation. Now, the poster presentations refer to the posters that you presented at a national or an international conference, maybe even like within the med school. I think that's still very valid. But, one question, at least among IMGs, is posters that were presented as a requirement of your community medicine, preventive and social medicine rotation. No, that's not really research poster presentation. So don't include that in your ERAS CV. The non-peer reviewed online publication, this is where you can write about any blogs or, you might have written. I think that's still very valid. Anything that you may have published online related to clinical medicine, you can certainly describe it here. Don't overdo it. If you have like 10, 20 blogs, just maybe the most 3, 4 most pertinent, most important ones, just describe that. Okay, let's look at the last two sections, which is the work authorization and then the language. So the work authorization for many IMGs might be that they're not authorized to work in the US. So one question that I commonly get is, should I choose H-1B versus J-1? And, this is a very personal decision. If there is any reason that you absolutely do not want J-1 visa, then don't check the J-1 visa box. And if you're okay with either J-1 or H-1B visa, kind of mark it the way I've done it here, and that's perfectly fine. Now, the decision is going to be yours if you want to give priority to the H-1B programs versus the J-1 programs. That's entirely your decision. Okay, language skills. Now, what's very important is you need to have an advanced level of proficiency in English or higher. And I think, like I said, in the last 4 years, what I've been doing this, there has been, I think, one applicant who chose good. And I had to tell them this is gonna, make it difficult for them to invite you for an interview, because they, at the very least, they want advanced English communication skills. So please work hard to get to that level, which is explained here, because that's very much needed in your daily work and communication. So I'm very glad they did this, because then there's less confusion. The next part is this: which of the language do you meet or exceed the good level of proficiency? So this is nice also, because I also, like many applicants, took some Spanish classes online, and would write, I know basic Spanish or fair Spanish, and I couldn't even speak a sentence. But now, because the word is now good level of proficiency, where you can need to at least have a conversation, they are really cutting down on people who will choose basic or fair just with the little knowledge of the different language that they have. So I think these are good, and there'll be less confusion now moving forward. So that's very nice. Anesthesiology, neurosurgery, and plastic surgery, they have these additional questions that you need to answer when submitting your residency application. These questions are based on things that came up at work, things like adversity, different decision that you needed to make, what's your ideal career, making a quick decision, negative feedback, what was overwhelming, some setbacks you had to make, you faced, collaboration, make quick decisions. So just some more questions for these specialties that need to be answered, and these are mandatory. So if you want to apply for anesthesiology, you need to answer this to submit your application. Thank you very much, everyone, for being here, and yeah, wish you all the very best.